Okay, welcome to Module 11. So in this module, we're going to go over a case with a 20-year-old male that has chronic gastrointestinal problems. Started in high school, started to get worse in college, and now in his adult life, he has persistent gastrointestinal symptoms. He's been to many gastroenterologists. They found everything from small intestinal bacterial overgrowth to some motility issues to nothing's wrong with you. He's worked with many functional medicine practitioners, implemented many dietary and nutrition protocols. Nothing has really made a big difference for him. So in this case, we try to discover what the underlying problems may be, why he's not responding. And then we get into the physical examination skills. And the physical examination skills, we're going to talk about why some people that have chronic injuries, whether it's chronic carpal tunnel or chronic elbow issues or recurring ankle sprains that just keep getting injured on one side, may really have a brain-based mechanism for their chronic injuries. So as you know, the proprioceptive information, muscle tone is all coordinated and controlled by the contralateral brain. So we talk about when you see a recurring injury, how to evaluate if there's a brain-based component to it by looking at motor function and sensory function associated with that limb. Then we get into the laboratory interpretation clinical profile for this module, and it's going to be on lipid phenotype testing or lipid electrophoresis. This is a test you can use whenever you see a patient that has really high cholesterol levels or really high triglyceride levels, and you test for a genetic hyperlipoproteinemia. And some of these genetic patterns have significant risk for cardiovascular disease, and some do not. So it's really important to test whenever you see very high levels of LDL or total cholesterol or triglycerides, and it allows you to really determine accurate risk. And then for clinical management, clinical parole, we're going to just discuss, strategies I found effective over the years working with patients and discussing how to develop a testing plan or a treatment plan within the limitations of their budget and how we can organize various things. So I'm happy to share that information with you. And that's going to really be the emphasis of Module 11, just these concepts, these experts. And I hope you enjoy it. And thank you for being part of the Clinical Mastership program.